Thank you. Dr. Chasen, I had opportunity to go to the Brampton Civic Hospital where you work and also toured the geriatric ward. And can you share some of the challenges faced by palliative care unit on the front line at Brampton Civic, which would provide a useful tool to making C277 and a future national palliative care plan?
Okay, so the international formula, and I know this question was asked, how many hospice beds do you need per population? So the Gomez formula dictates between 8 and 10 hospice beds per 100,000 population. So if we have 1 million people in Brampton, we are looking at a lot more than 10 beds, which is what we have at the moment. There are initiatives at a provincial level to build hospices, but we have the issue of that 54% of patients are dying in acute care hospitals when we don't really want 54% to be dying in acute care hospitals. We have shown that the better the community supports, the more likely the patient is to go home and not bounce back into the emergency room. So I think that's where our issue is. We don't need necessarily only hospices. We probably need some form of a step-down facility where you don't have a physician going in every day, maybe every second or third day, where you don't need one nurse per 3 patients, but maybe one nurse per 5 patients, where you concentrate more on patient care, not just necessarily giving them the medication, where you bring in psychosocial support, which is so poorly lacking. There's very little funding for spiritual support, for psychosocial support. A lot of that funding is being brought in privately, or for people are donating money, and we're raising money from a charitable organization. I think palliative care needs to be brought into the Health Care Act. Hospices really need to be brought in as well, that they're not a separate entity, and that could increase the continuum. We don't need fragmented money coming from different areas. We need one pool, and everybody should be going on along that line.